Hello, this is Dr. Joydeep Chaudhuri with Academics in Nutshell. The topic of discussion is CBC in infections. The various cells in the peripheral blood may change in various infections, and that may be an indicator of certain infections. To start with RBC, the mechanisms of anemia of infections are shortened RBC survival, impaired marrow erythropoietic response, improper iron mobilization, immune and non-immune hemolysis, microangiopathic hemolysis, also hemophagocytosis, and blood loss due to intestinal parasitic infestations. Usually it is following an infection of long duration of more than a month, like tuberculosis, osteomyelitis, bacterial endocarditis, empyema, lung abscess, and chronic fungal infection. To differentiate anemia of chronic infection from iron deficiency anemia, the TIBC and ferritin may be diagnostic. The TIBC is normal or slightly low in anemia of chronic infection, whereas it's high in iron deficiency anemia, and reverse is ferritin. The normal WBC count in children is usually 5 to 15,000 with lymphocytic predominance over the neutrophil count, but it may vary as per the age also. The leukopenia is typically seen in viral infections like infectious hepatitis, infectious mononucleosis, rubella, measles, dengue, influenza, and among the bacterial infections, Shigella produces leukopenia with marked increase in band cells. Also, the overwhelming septic conditions like meningococcal infection, pneumococci, staph, typhoid, and paratyphoid fever may also cause leukopenia. The neutrophilia, where the absolute count is more than 7,500, is typical of bacterial infection, but viral infections also initially may produce neutrophilia, whereas neutropenia, the absolute count less than 2,000, is usually due to overwhelming infection, and most of the viral infections like infective hepatitis, infectious mononucleosis, etc. will cause neutropenia, and among bacterial infection, typhoid and brucellosis may cause neutropenia. There may be various morphologic changes in neutrophils like band cells, toxic granules, dull bodies, vacuolation, which may be the morphological feature of typical infections. Lymphocytopenia is seen in active tuberculosis and sometimes in malaria and pneumonia, but lymphocytosis absolute count more than 4,000 is present in chronic bacterial infection, particularly tuberculosis, and also some acute bacterial infection like pertussis, but except in infants less than 6 months, and atypical lymphocytosis may be feature of viral infections, particularly infectious mononucleosis and cytomegalovirus. Eosinopenia is typically seen in typhoid fever, but may also occur after administration of pharmacological dose of steroid. Eosinophilia, absolute count more than 4,000, occurs in helminthic infections, but protozoal infections also, except malaria, may cause eosinophilia. The greatest degree of eosinophilia is present in helminthic infections with tissue invasion like filaria, enterobius, etc., and recovery from bacterial infection where there may be mild to transient eosinophilia. There may be Peltier-Hewitt anomaly where the granulocytes and eosinophil with 1 or 2 lobes per nucleus assume a round shape, which is commonly found in tuberculosis. The basophil count increases in TB, influenza, varicella, hookworm, and decreases in any infection, also in corticosteroid therapy, whereas monocytosis is seen in protozoal infection and also rickettsial infection, and sometimes in bacterial infections like TB, typhoid, endocarditis, and brucellosis. Thrombocytopenia may be a feature of septicemia, especially meningococcal gram-negative infections, which may also cause DIC. Some of the common infections may have some typical features in the peripheral blood count, like in typhoid there may be neutropenia with eosinopenia, whereas in dengue and other viral infections there may be lymphocytosis. In malaria, monocytosis may be a feature. Decreased platelet count is often a feature of dengue as also malaria. In neonatal septicemia, leukocytosis may not be seen where neutropenia often is present. But the most helpful signs are increase in band cell count, toxic granules and dull bodies. Thank you. See you again.